The type of patients that we typically see related to back and spine pain due to their posture are patients that do a lot of sitting throughout the day. So for example, truck drivers, students, or people that have a desk job that work at a computer for most of their day. The common cause of posture-related back pain is the fact that you're not keeping your spine in a good neutral position. There's intrinsic and extrinsic factors. An example of an intrinsic factor is just using your muscles to stabilize your spine. An example of an extrinsic factor would be the chair you're sitting in may not be sized right or appropriately for you. Potential warning signs for posture-related back pain would be pain, generally. Typically, we see pain occur after you've been sitting for a while. As time progresses, that pain will start to occur earlier. So, for instance, you may have pain 2 hours into sitting. As it progresses, it may be an hour into sitting. And when you notice that happening, I think it's important to consult a therapist. Treatment for this can be very effective. It can be very quick. And if we change some of those intrinsic and extrinsic factors that I alluded to, we can see pretty quick changes. So I'm always amazed at how patients that have had years of back pain due to posture-related issues, they'll come in the next week after making some of these changes and feel quite a bit better. I think one of the big benefits for long-term sufferers is it allows them to actually do their job with less pain. They can concentrate better on what they're supposed to be doing instead of concentrating on this nagging back pain. Outside of job-related issues, I think they're able to do more. We have a lot of people that maybe can't drive in a car for 2 hours, so they have trouble traveling with their family. And when we make these changes, all of a sudden they're able to do more, and it opens doors for them to be able to travel with their family. Unfortunately, we don't see a lot of people that come through in a preventative basis because pain is what brings them in. However, what I typically see is the earlier people get in, if they start to have pain and the earlier they get in to see us, we can make that change very quickly. Other benefits include, outside of just getting rid of your pain, it has a positive impact on the pulmonary system. So it improves your lung capacity if you're in a good posture, and that has implications for long-term health.
It is very important that a chair should be the right height. And the way to know if you're in a chair that's the right height, you want to have the hips bent at 90 degrees and the knees bent at 90 degrees. So the feet need to be flat on the floor. Just to show an example of how it feels if your feet are not on the floor, if you lift your feet, Adrian, both feet up. You feel how that puts more stress on your back? Okay. Now go ahead and put both feet back down on the floor. You feel how that takes some pressure off your back? Okay. So chair height is very important for assuming a good postural position. Once we've established that you're in the proper chair, the next part will be to maintain your spinal curve. And what Adrian's going to do here, I'm going to have her sit with bad posture just for a minute so she can feel that. And that puts a lot of stress down in your low back. Now I'm going to have you sit real tall. And that almost doesn't feel real good. It almost puts a little stress in your low back as well. So what we're going to do is find the correct position for the spine. And the way to do that is for her to kind of rock back and forth between bad posture and really straight posture. And if you just kind of rock back a little bit forward, you feel like you kind of hit a spot there that feels pretty good. You'll feel like you're taller, but you won't feel like you're hyperextended too far back. There's actually a flat shelf of bone kind of in your butt that allows you to sit balanced in this position, so you should feel comfortable there. Once you find that position, you want to use your core muscles to try to maintain that position. So you're going to just slightly engage your muscles in your abdominal area, and that should help you maintain that position. One thing I like to use to help maintain this position, because Adrian will tire if she stays in this position for a long time. She'll start to fatigue. She's not used to this position. So lumbar rolls can be used to put behind the low back, right in the arch of the back there, and can give her a little bit of stability. And so that allows her to still use her muscles, but it gives her a little bit more support. If you don't have a lumbar roll or have access to one, you can also roll up a towel and use a towel for support.